Welcome to the GFY podcast, a podcast healthcare professionals providing insight on how to navigate your health so that you can go fix yourself. The GFY podcast hosted by Mike Bruno, chiropractor and athletic trainer, and me, Michael Stant, an athletic trainer and certified strength conditioning specialist. Although we are healthcare providers, we are not your healthcare provider. We'll discuss general health interventions in this podcast, but you should not take that as health advice that works in every situation. Before doing anything on your own or making any lifestyle changes, please consult with your own physician. This podcast and views from this podcast are separate from our full-time jobs and our own opinions. If you're enjoying the GFY podcast, please leave us a review on your listening platform and or subscribe to our podcast at YouTube. Links to our show can be found in the show notes on any platform that you're listening to. So today's episode topic, we're going to approximate 6 simple ways to address your back pain. It's a very loose 6.
Oh, dude. This is the best.
I mean, I always kind of call chiropractors the spine doctors. Is that bad? Should I not say that?
Should you not say chiropractors or spine doctors? I mean, the people, like, I'm not a like Dr. Mike Bruno kind of person. So when most people just call me Mike, which is which is preferred. I had one of my clients is funny. She was like, I don't know what to call you. And I said, whatever you want. She said, Dr. Bruno sounds too formal. Dr. Mike sounds like weirdly insulting. I don't play football with you, so I can't call you Bruno.
Whatever feels. Yeah. It's like, call me Jerry. But yeah, no, always because technically, if you're going to actually get something done on your spine, you're going to what are you going to? Neurologist?
Well, it depends on what you mean by spine doctor, because there's a lot of specialists that you can see. Physiatry. I don't know if this is item number 1 or no?
This is. I just kind of thought about it as we started.
I would say if you say spine doctor, there's the surgical route and there's a non-surgical route. So if you were to say non-surgical spine doctor, that's like DOs, chiropractors, maybe even
but even then, I guess it depends. They have to specialize into that, because like a DO is like they actually learn. The only difference between like DO and MD is really they end up doing a bunch of like manipulation stuff that they have to learn, right?
Yeah. So there's it's funny, like I have a friend who's a physical therapist, and every time I see him, he's asking me to teach him how to do manipulations because he wants to be like proficient at it, but he learned it one time in a semester. When I was talking to Courtney about this, when I was going through chiropractic school, this is a story that I like, it's always burned in my brain. She goes, yeah, we don't really learn a ton about chiropractors and manipulation and stuff. One slide in one class one time said, chiropractors cause strokes, don't do neck adjustments, moving on. I know that was it. Dude, talk about black and white. Oh,
that's how PTs come at you. Sorry, everyone's got their turf, I guess. It would all be better if we didn't.
I mean, PTs and chiropractors, if you're a very high quality PT or chiropractor and someone comes and see you, they shouldn't be able to tell what your degree is technically, because the scope is so similar. I have people all the time who come in for a consultation, and by the end of it, their questions are, what is your background? Like, what do you do? I license chiropractor and athletic trainer, but the goal is to, get you doing your thing. So it doesn't really matter.
Yeah, there's a lot of crossover between all three, and like everyone has like all three of the. Man, we really went off topic here, but all three. Yeah, all three have like their little niche and whatnot in it. Like, physical therapy kind of started off with, all right, we got movement, and that's how we're gonna get things better. Athletic trainers, honestly, it's like we have the rehab aspect, but the biggest thing that separates athletic trainers is actually the emergency action planning, the emergency care, things like that, probably from like the general health perspective, and then just having it's much more sports focused from the very beginning to the schooling,
which helped me in chiropractic school so much.
Oh yeah,
I have friends who came in with psychology degrees or business degrees, and they really cadaver lab was
Oh, yeah.
rude awakening for them. And I was been there, done that.
And probably just even like simple rehab principles. Like,
I
I don't
don't
know,
we
you don't
we
learn it.
didn't learn we I mean we did have rehab class, um, but because was whatever 5 years ahead and had practice and reps and jobs in the industry and stuff prior, we would go over the very basic bare minimums, and that was it. So some people were that's that's their starting point, and I'm looking at it like this. Half of this stuff doesn't even work, and
Yeah.
because I've been there and I've done that.
Yeah.
Uh, it was more of a this is what you need to know to pass your boards type thing. So me and my rehab professor did butt heads a lot because 90%, truthfully, 90% of what I do is um, education that I've sought out on my own post grad.
Yeah. I would honestly say a lot. It's the same for me.
Yeah, one of my buddy's dad's chiropractor for a long time, and he always said, "Just go get your paper, go get the degree, and then figure out how you're going to practice afterwards." 'Cause
Which is kind of sad, but yeah. But I mean, that's probably every health
it's
profession in a sense. Like,
yeah.
there's too much to go over to really get it in the school itself.
And what I've seen get people better, we're really tangenting, but what I've
Yeah.
seen what I've seen get people better most of the time isn't the traditional methods anyway.
No.
So it's hard to rationalize. Let me try the traditional stuff first because that's more of a shotgun approach. It's, hey, this is what usually like gives you if basically if you were had zero experience, that stuff is your they call it like your best shot at feeling even slightly better. Um and usually it's, oh, okay, like maybe I did notice something. I always tell people if it's not a hard yes or a it's if it's not a hard yes, it's a hard no. So we do something, exercise or intervention. Hey, like, did you notice a change with this? And they say, well, like if they start like that,
Yeah, I always have to tell like if anytime I give someone it's like all right like did like the same thing did you see a change and like they're like hesitate to answer I was like you can say no you're not going to hurt my feelings like that's
yeah,
so I like you always have to like I always have to give that preface like I saw something I thought would work but for some reason it doesn't work for you fine we go back to the drawing board and figure it out.
right. And that's the whole part because something that could work for somebody on Monday, they could have a terrible night's sleep and it could not work for them on Tuesday.
Yeah.
So being able to be fluid in what your plan is, when you know what the goal is, you can make pivots and detours on the route to still get you to the end goal.
Yeah. All
Cool.
right.
Now let's start
Stop
the
that. Stop that. Yeah. All right. How we're gonna address back pain? So I made a list of 6 things. Bruno will agree or disagree or add, do whatever the hell he wants because that's what he already does anyway.
Yeah.
So number one, my first simple thing, especially for like the general population, I would say I'm not talking about like athletes, like legitimate people training for sport, but so number one is just be more active, be more physically active because a lot of times that will solve a lot of issues for your sedentary population.
Yes. One of the common isms that people say is motion is lotion. And
Yeah.
yeah, it's not the prettiest sounding thing. There's some value to it because if you're doing nothing, something is better.
Mhm.
The caveat to that is when someone says, okay, but everything hurts. What do I do? Where do I start? So if you're blindly giving that recommendation and they say, okay, well, walking hurts, but you're telling me to move, so I'm going to go walk anyway, and it exacerbates symptoms, that can get you into trouble. Um, but for the large part of the population, you will be better off doing general stuff more.
Yeah.
Doesn't have, yeah, sorry. That
No.
name specific is
Yeah.
at that level is not a thing.
Yeah.
It's do something.
Yeah, and even then, like the people where you might exacerbate it because for whatever reason it is, like to be more active. Also, we're saying walking. It can really be anything. Like go back. It could be an arm bike. It could be elliptical.
Yeah.
It could be biking. Like it could be something. It's like whatever kind of gets you a little bit of a sweat.
Yeah, the point is you have to find your entry point.
Yeah.
So, especially when I work with people, the goal is to find something that they can tolerate on day one, even if it's a super acute problem where everything hurts. Sometimes the answer is a breathing exercise
Yep.
and holding a position. And that is enough to get the ball rolling. And then you stack from there.
Yeah, even like I go back to like post surgical, like even you get that person post surgical, if I can't do anything, it's like I do tell people just do glute squeezes. Like it's
Mhm.
something like just start doing a little bit of something, kind of like breathing exercise where like you're not making movement, but hey, you're in a position and focusing on breathing. That's enough.
Mhm. Absolutely. Absolutely.
Sweet. All right. I don't think we have to belabor that. Two, I think kind of goes with one is be more social. Like, and maybe that kind of, whatever way in which you can make ties or communicate with people or like find something that's a like interest, like, right. I love going out for coffee. Me and a lot of my friends, I always be like, hey, let's go grab some coffee. And that's like a very social event. Even
Mhm.
running clubs. Like I'll probably be there tomorrow actually, where I go to a running club and I just
Mhm.
we jog. I don't really go very fast. I talk to the other person. It's very chill.
Mhm.
It's actually coffee afterwards too. So guess what? More coffee. So that's for me, it's really just have more coffee.
That's funny. The social aspect, the big fancy term I'll use is biopsychosocial.
Yep.
So that's a model in for people who don't know, that's a model in pain. So there's bio, the physical part of it, psycho is the mental part of it, and social is what Mikey just alluded to. So having most pain has is not just one of those things. It's a combination of all three of those things. So if you hammer the physical, but ignore the mental and the social, the likelihood of you having a full, complete resolution is much lower.
Yeah, and like even kind of going off that, right? If you break down, let's say, all right, you have the bio, someone has an ankle sprain. Okay.
Mhm.
So you just hammer that away and you give a blanket statement of you can't do anything physically. Like there's no bearing way. Hey, you can't do anything until the ankle sprain has fully healed. You can't go for
Yeah.
walks. You can't do
Mhm.
this. You can't do that. So that's when, like us, we have to take into account, like, okay, well, what is that going to do them from a psychological standpoint? You're probably taking away from their favorite activity. And then from a social standpoint, okay, was that activity how they socialize and communicate with other people? And that's what you have to kind of consider.
For sure. And that's also why I really like the 1 hour one-on-one model because there is a built-in social and mental component to it where we're always sitting down and having a conversation prior to getting into the physical stuff, which is really helpful for me to understand where their head's at so I can give them the appropriate stuff to do. Because if you miss that part and you come in and you treat everyone's back pain the same, like it's car on an assembly line,
Hmm.
right? Maybe that works for 1 out of 10 people, but the other ones either don't notice any change or get worse. It's the percentages are not good. So the whole goal is to be able to address the full person, which is not just the physical injury, like, "Hey, my back hurts."
Yeah, and like even so, like we've talked about manual therapy before and whatnot. We use it as like our window of opportunity to kind of get someone over a hump. I honestly use it as a great opportunity just to have a conversation with someone like as I'm doing treatment. It'd be like, hey, how you
Mhm.
feeling? What's going on with your life? How's this? How's that? Like in the college setting, it was very easy to make those connections, like right because you're working with people for sometimes 5 years.
Yeah.
So like a lot of times you just be chit and chat and see what's going on. You kind of pick up, especially in the college setting. Oh, I broke up with so and so, and it's like, oh, well, this could very well be leading into your back pain that you just suddenly had this past week. So definitely
Yeah.
a big part to it.
I feel like one of the things you always used to talk about was the injury incidents around finals,
Yeah,
which
yeah, yeah,
so people are more stressed out because of school, especially student athletes, and they get hurt during that time a lot more frequently is interesting.
Yeah, it's all the stress aspect and a lot of different things going on, and it's like it also just naturally occurred as well with like middle of the season, like a lot of wear and tear, or like it'd be like out of season, and it's like maybe it always be like maybe us or like us the AT strength conditioning coaches there, sport the actual coaches, like maybe we deload them that week of midterm or finals or whatever it is. So
Mhm.
I'd be curious if that's happening anywhere. I mean, I don't know. Sports science is really blown up, and like you would think that with the amount of info they probably have coming in, there's some team taking care of that.
Yeah, you would think so.
All right, I'm gonna move to number three. Kind of
Number
with
3.
number three, nutrition and diet. And
Mm.
so obviously, I'm gonna say we stay in our lanes.
Mhm,
We're
mhm.
not, we're not the dietitians at all, but we do have our general background on. Okay, can it be that is it weight a problem? Is it what you're eating? Do you recognize that? When I have a bunch of sugar this day, I'm in worse pain. Is it I had a bunch of alcohol, I didn't sleep well, I
Mm.
wake up the next day and I feel my back hurting. I feel like a lot of people struggle to actually make those connections, and it could just be because they don't track what they do. Like, right? Like how many people are actually tracking what they ate the day before, what they drank the day before, and then also looking at like, oh, what is my pain level on a day by day basis, or even looking at their sleep.
This is a perfect platform because this is something that you really have to say with caution, usually.
Yeah.
When I'm talking to people and they're describing their back pain and they throw it in on the side where they're like, "Yeah, this is bothering me, that's bothering me, and I could probably stand to lose 20 pounds, and, like, that would help me lose my back or, like, reduce back pain." And I I wanna what I wanna do is sit there and, like, turn my head and ask them, "Do you think every fat person has back pain?"
Yeah, it's a
Because the answer is no.
yeah.
There are people who are way fatter than you who have way less back pain. So, could it be a contributing factor in some cases? Sure, I'm not gonna take that away, but don't use it as a crutch as an or as an excuse because the mental component of that is, "Hey, I need to lose this weight to get out of pain," and that's just not true.
Yeah, I feel like that sets people up for failure. So, like, when you're just looking at that scale number and maybe your weight isn't going down, you're probably gonna just start thinking, "Oh, my back pain's not gonna go away." You probably never wanna make that connection.
Yeah.
I'm thinking, because it's funny, I actually just started weighing myself regularly recently just because I was more curious to see what I changed my diet a little bit to see what would happen.
Mm.
But I'll be honest, I usually never make that connection of like, "Hey, we're gonna do." I don't want people to go for numbers when it comes to weight. I just want for people to go for like how you feel. Like, right? It's kind of what you do. I want you to feel better off the back pain. If you lose weight as a result, great, awesome. But really, you're just going for the how do you feel after it, and it doesn't like right. We do like general lifestyle changes, and those will probably help people. And like for you, when we talked about earlier, hey, how about you just start walking a little bit? Like, we'll start with 1 mile a day in the morning. That's all you got to do. And that might be a huge difference for people.
Yeah, we always have to put a target on the wall, and does the question always refers back to, does this get us closer to the target or does this get us further away from the target? Whether it's walking, a specific exercise, changing your diet, your sleep habits, all of those things are important factors. And we have to move the big rocks first because all the perfect exercises in the world aren't going to help your back pain if you're a severe alcoholic who never sleeps.
Yeah.
So we have to know which levers to pull at what time. And the important thing, it's important to consider all of those things and know about them, which comes back to having conversations with your clinician. Because if you're leaving, I've had a, professor tell me before, he said, you'll be amazed at the things people leave out. So, phone consultation, we're going through injury history. Okay, nothing too crazy to talk about. And then I meet them in person and they're, "Oh, wait, by the way, I forgot to tell you I had my hip replaced last year." I You forgot? What?
You forgot. I mean,
Yeah,
must be a good recovery. But like,
yeah,
um, damn. Yeah, I don't even know how to come back off that one. You lost my train of thought. That's fine. Right? It's gonna. Oh, going back to it, it's like I stand to lose 20 pounds. And we've talked about it before, right? It's not an information problem. Like people generally know what they need to do from a diet standpoint. I
Oh,
like right. Everyone kind of knows. Okay, I got to eat less. I got to eat
yeah.
the healthy foods. But right, the struggle is the implementation. It's like how do you create the discipline for them?
Information is free, implementation is key.
Yep. Perfect.
Boom.
Let's go. All right, number
Wow.
four. Number four, figure out your root cause. And I think for back pain, right? Because and we've talked about it plenty of times before, it almost is never because of the back. If you're thinking of that bio standpoint, it's
Mm.
most likely something in the hip. Heck, it could even be you have limited ankle dorsiflexion range of motion that's leading to your back pain if you really want to go all the way down. Maybe it's something going on with your shoulder that's causing you to compensate your back when you go into a back squat or a front squat or something.
Yeah.
Um, Go ahead. You're itching.
I mentioned I started using the word root cause all the time. And now there's a huge shift in where I see everybody saying
Oh,
it.
I see it everywhere now. Yeah.
Yeah,
You should have trademarked that. You were early.
maybe. And the frustrating part is when you say root cause, the perception is root cause means one thing. So, hey, my back pain is not being caused by my back. Okay, it's being caused by something else. What is that one other thing?
Yeah.
Still missing the mark.
Yep.
So back to what we were talking about before with the biopsychosocial, we have to understand all three buckets for people. And the physical is the most obvious. And then it's our job as clinicians to understand the psycho and the social, maybe not indirectly, more indirectly,
Hmm.
asking the right questions at the right times to get a better understanding. Because I know from my experience, I was sitting in a doctor's office at my yearly physical, and the lady goes doing my intake paperwork, the assistant asked, "Are you a smoker?" And I said, "No." She goes, "Okay, you don't smoke anything ever?" And I said, "Oh, I mean, I have a cigar at a wedding every like maybe 3 times a year or whatever." Then the doctor comes in, she's like, "Okay, so how long have you been a smoker?" I'm like, "Whoa, whoa, whoa,
Yeah.
whoa."
There's a difference.
Yeah. So being able to have a conversation with somebody to really understand where you're coming from because it's so easy to get stuff lost in the shuffle.
Yeah.
So back to root cause, right? With from a physical standpoint, specifically with back pain, I look at it in three buckets where we could have a hip, we call it asymmetry problem. So does one hip move a lot more or a lot less than the other? We look at spinal flexibility because most people are focused on stiff core and braced core, where a lot of problems actually come from the core being too stiff. So we have to look at their flexibility. And then um, a so that call it more spinal flexibility with a the other option being a core uh, stability problem. Hip asymmetry, core stability, spinal flexibility. Those are the three big buckets I look at from a physical perspective when it comes to back pain.
Yeah. Yeah. I think once again, I think it's more important that root cause doesn't mean it's just one other thing. Cause I think there's a lot of times like you'll have something coming in. It's like, oh, I'm pretty sure it's because I did this one thing.
Yeah.
Um, and like I'll speak about myself, right? I had some right foot pain for honestly a few weeks, 4 weeks.
Mhm.
And a lot of it was one, I just said, "Yep, that's because I ran like an asshole the past 3 weeks prior to it happened. I ran a marathon. I got pissed I didn't do well, so then I ran 20 miles 2 weeks from that. Then I ran a half marathon the following week. Yeah,
Mhm.
like I spiced my workload. That's probably it. But I probably also didn't recover very well from all that. I was an impending father, on the way, so it's just like I had a lot of stuff going on that I definitely did not match the recovery from any of it. So
100%. Yeah. And even with this, uh, we do this barrage of testing for those three buckets to see which one that you fit in best.
mhm,
Usually people have signs in two or three of them. So you do all those tests, and if you don't have someone working alongside you, it's confusing because you have positives show up in all three, depending on where you're at with your back pain.
Yeah, what I would say too, it's like, right, and you have the acute, like, and you're going with back pain, and let's say you do have the I lifted, ow, went my back, like you maybe actually strained a muscle and whatnot. You're probably going to start in that bio part, and if you don't treat it right, you start bleeding over into like the psychosocial aspect of it, and that's probably what
Yeah.
happens with most people, because
Oh yeah.
and like me and you probably do it too. Is you just don't actually take care of an injury the way you should. You go to a doctor and they go, hey, just rest for 2 weeks and you'll be fine. So you go, all right, I'm going to do absolutely nothing for 2 weeks. And then you try to just return back to where you started. And it's
Yeah.
just an impending uh, cycle.
Yeah. A lot of what we do is rebuild confidence. As an example, I had a client come in, years of back pain, uh, but was a competitive horseback rider, was a black belt in jujitsu, badass.
Yeah.
And the way that she talked to herself was, "Oh, I'm broken." Every day. I was like, there's so much evidence to say the opposite.
Yeah.
So again, more indirectly having those conversations to the point where we finished the plan of care. And she said the most valuable thing that she got out of our sessions was that she no longer calls herself broken,
Yeah.
which is huge.
Yeah. That's the goal. I mean, I think outside of any catastrophic injury, like when you just have like on back pain or any pain that just kind of gradually comes on, it's probably correctable. Like you can probably do something to get yourself in a better spot. And it's funny how much the mental side of it actually affects it.
Mm. It's huge because if you have back pain and you stop doing the things that you love and you go down that rabbit hole, then you start telling yourself, I can't go back to doing said thing because I'm going to hurt my back again.
Yeah.
And you start avoiding stuff and then you become sedentary. And then when you're sedentary, your risk of all of the other bad things goes way up.
Quick tidbit for you know, back pain actually costs our medical system the most out of anything else, except for maybe cancer.
Like, yeah, back pain is the biggest burden on the healthcare system.
Yeah. Sorry. Side note. I was just reading something about that. Um,
100%.
Number 5, by the way, on my list was address your mental health. So I feel like we essentially just
Cover that.
yeah, that's covered. And number 6 is finding or getting educated surrounding your back pain. So there's more and more research coming out. And we may have talked about this an episode or two ago, but when it comes to a lot of injuries, like what your actual like exercise rehab plan is that you implement doesn't matter. Like they did a couple control trials. So it's like one group had exercises only, one group had education only, one group had exercise and education. And essentially, both the education and exercise and education group improved like their pain. The exercise only
Mm.
group did not. So what they kind of took out of it was
Mm.
the education aspect of understanding back pain, and or really it was a couple different areas of the body, but educating like this is what is going on. This is how we're going to address it. This is what you should feel went way further than just, here are your exercises. They're going to get you better.
I agree with that. The thought process of dropping your spine off like it's a car and saying fix it and then I'll
Yeah.
come back and pick it up is what most people assume rehab, PT, chiro is, but it's not.
Yeah.
The ability to understand what your problem is so you know what is, again, getting you either towards your goals or what is taking away from your goals. Because I've had conversations where clients have been telling me, oh, I'm doing the X, Y, and Z exercise because I saw it on YouTube to fix my back pain. Um, and then they show me those exercises or we go over them, and those things are actually causing interference towards their goal because they think they're doing something good for themselves, but they're actually doing the opposite. And they're not doing it on purpose. It's a lack of education where they trusted a source without context or being able to go back and forth and it got them stuck.
And I will also say too, when it comes to right, the reason why the exercise only group probably didn't work. So what they probably tried to do was kind of what people do in traditional PT. They tried to say, all right, we got these group of 25 people that got diagnosed with SI joint dysfunction. So they're going to do these 5 exercises for 6 weeks and we'll compare it to the other 2 groups. Well, right, if you're not personalizing your plan of care for why are they having a SI joint dysfunction, you're gonna get a large mix of
Mhm.
results. So,
Mhm.
probably why that research also didn't really work too well for the exercise only group.
100%. And that's why the general recommendations, you call it cookie cutter, you can call it generic, when it's just a general thing. The goal is not to help everybody. The goal is to help 1 out of 100, you know,
Mhm.
1% to 10% of those people are going to get what you want out of that thing. So I would rather go much more shallow, or sorry, much more narrow and deep, and help a lot less people, but those individuals help them a lot more completely.
Yeah. I'll give a quick example from that standpoint. It was actually my mom. This is probably over a year ago. She was having back pain. She works at a farm and lifts a bunch of like baking sheets and stuff and like that. Started back pain. So I honestly did the quickest eval you could ever imagine because she like mentioned it on my way out. But it was straight up like she had no like she couldn't like do any type of hip abduction. Like she could not be in a single leg stance or anything like that. So I legitimately gave her, all right, we're gonna do these 3 exercises, do it, sets, reps, whatever. And she's like, "Yeah, I was good in 3 days. I felt great." And it's like, "Okay, cool." Like, right? Because guess what? I just kind of focused on the hip aspect of it. I honestly didn't even tell her to do anything core related that you honestly a lot of people think. I didn't even attack mobility on her. I straight up just did hip abduction and
Mhm.
you got a quicker result.
Mhm. Yeah, you have to know your starting point and why it's happening. You have to know what the goal is, because if you don't know those 2 things, you're going to be wasting a lot of time doing things that don't matter.
Yeah.
So for you, you knew exactly what her starting point was. You knew exactly what her goal was. So giving 1 or 2 exercises is going to be a lot better of a solution than sitting down and having a dissertation with her and trying to teach her all of these things and try to
Yeah.
become her own PT. It's not helpful.
No, yeah. And there's a lot of people that don't want the dissertation. Although I used to really enjoy the all right, I'm gonna give a dissertation on rehab of whatever with my baseball athletes. You realize a lot of people don't want that.
100%. Some people like nerding out, and that's
Yeah.
great. I'm all for it. When I start asking questions, I get excited. But for people who are like, I need your help, I trust you, do what you think is best, I'm going to have conversations with them much differently than people who are asking, why specifically do you choose this and not that?
Yeah. Exactly. So all right, those are 6 points. There it is. Jesus. All right. Go fix yourself.
Yeah, buddy.